In this video, we're going to look at how to analyze an interstitial lung disease pattern and to assess when there's a possibility of superimposed emphysema spaces on the interstitial lung disease process. This is a 3D image of the lung, and we're going to go to the standard axial images as you would normally encounter in your practice. So here we are, and we're going to go to the axial images. And in this patient, I'm going to get the zoom settings better arranged, so it's clearer for you to appreciate this. So we have a situation where there's an interstitial lung disease process, mostly manifested by macrocystic honeycombing and subpleural reticulation with little ground glass. Towards the bases, it's rather obvious that the process occurring is an interstitial lung disease process, but towards the apices, there can be some doubt as to whether there are some superimposed emphysema in these regions. To sort out whether the observed cystic pattern is due to emphysema or purely due to interstitial lung disease process, the best method is to assess the airways and their orientation. You're better off doing this on a sagittal or coronal image. So we're going to get a relevant coronal image and get it into an appropriate zoom setting and centerline it so it becomes quite clear. And there we are. And then, in order to appreciate the airways, we're going to put this into a minip setting. Like so. Your attention is now drawn to these airways. If you follow the airways extending into the area of question, or area in question, and get the window settings a bit better, you can see that the airways have got a beaded appearance, which distort in their orientation, and this is observed on multiple airways towards this area here. This implies that the process occurring here is likely due to fibrosis, pulling or giving traction effects and pulling the airway to various directions, like so. Just get the settings again to a better setting. So just follow this airway here. We've got the right upper lobe bronchus, and you can see it does not go in a straight line, and it tends to deviate as it progresses through. And this is a very strong indicator that there's unlikely to be an emphysematous component, and instead there's going to be a fibrotic component in this space.